Welcome to Azad Bioacademy. Today I will talk about Prodrug. Usually we know we take drug as active form and it will enter in your body that will show its biological or pharmacological activity. That is the common concept. But some drugs are taken as inactive form and it will turn into active within your body and then it will show its activity. That means drugs are taken as inactive form and then it will become active within the body. So those drugs are called prodrug. So why it is called prodrug and why we are taking those drugs as inactive form? What are the purposes and where it will active? We said within the body, but where the site of the activation. So these are very important angle of the today's topic. So we will solve all the problems or all questions which will come in your mind. So first of all, the title is Prodrug. So if you look closely, this Prodrug, so this is a prefix that is pro and it says drug. That means you know the definition of drug, any chemical substances which has ability to alter the biological physiological activity, that is called drug. And it's a pro, that means it's not yet a drug and it should be a drug. Okay, so that means it is inactive. Okay, and it must be active. That means this is active and that will happen within your body. Okay, so this is product concept. Drug to be taken in inactive form and after entering into the body it will become active. Okay, so this is the prodrug concept. The question is why we will take inactive? We can easily take in active form, but why we will go back to inactive form? So it has some purposes. Okay, so if you think very profoundly about the basic of your pharmacology, that is pharmacodynamics and pharmacokinetics. Okay, so pharmacokinetics means ADME and pharmacodynamics means the activity and its mechanism. All the angles, all the basically the sides of pharmacokinetics and pharmacodynamics, the prodrug concept has some application. So if you think like ADME, that is absorption, distribution, metabolism, and excretion. So you can modulate for your betterment as product formulation or product design. You can get some benefits, that is effect, related to effect. That can be good effect or targeted effect, or you can minimize some toxicity. So that is also effect. So if you combine, you can say this is pharmacology. Okay, and has some benefits regarding related to drug that will come as like a pharmaceutical benefits. Okay, so firstly, I will discuss where in your body the drug will become active from the inactive. It can be within your mouth, it can be within your intestine, it can be in your liver, in your systemic circulation, that is plasma, or even your target tissues. Okay, anywhere drug can turn into active form. So why we will take inactive? That is the purposes, that is, and where it will active. So now one after another, firstly I will discuss about the site of activation. So site of activation, basically we will talk about like very minor amount of drug can become active in your mouth as your saliva has some enzyme. I will ignore it. Now I'll go back to the intestine. So intestine has a greater intestinal wall and it has different types of enzymes that can turn active drug to inactive or inactive drug to active. But our today's topic is inactive to active. Some drugs can become active. Like if you think about the olmesartan, olmesartan, medoxomel. That is your inactive form, and it will turn into active in your intestinal wall. That is olmesartan, and it will quickly go to the systemic circulation through your liver or elsewhere. Okay, so this is a site of activation of drug that is like olmesartan, midazolam to olmesartan. Now, if you think about your liver, some drugs just convert into inactive to active. Like you can think about your uh, simvastatin. You can think about your clopidogrel. Okay. So if you just, I will mention the class of drug that is, the antihypertensive drug. Simvastatin is a lipid-lowering drug. Clopidogrel is your blood thinner. If you think about your capacitor being, that is anti-cancer drug that will convert into 5-fluorouracil. 5-fluorouracil. Actually something happening in the liver, and finally it will go to the target tumor, and then it will convert to cancer cell, and then it will become more conversion, and then it will work. Okay, so that will be the mechanism. I will not go for that. And enalapril, that means that can be active in enalaprilate, so that will happen in the liver. So this is liver, and this is happening in the intestine. Okay, now I will go for the plasma, that is systemic circulation. Some drug can be active, like that is enalapril, that is enalaprilate. Although some conversion may happen in your liver, but mostly your plasma. And you can think about that is first propofol, that become propofol. That is, that is the anesthetics. If you think about the first phenytoin, that can turn into phenytoin, that is the antiepileptic drug. So these drugs are the example of prodrug that become active in your plasma. Okay, so that is the plasma. The drugs already I mentioned the name, that is enalapril to enalaprilate. That is first phenytoin to phenytoin, and first propofol to propofol. So and you can think about aspirin, that although the acetyl salicylic acid and salicylic acid both are active, but when acetyl salicylic acid turn into salicylic acid, that is the prodrug, and that can happen in your plasma. Okay, and if you think now the target site activation, target tissue. So now target tissue activation, you can say the levodopa. This is the anti-Parkinson's drugs that conversion will happen within your brain. And if you think about the nitroglycerin, that will happen in your smooth muscle, that is a vascular smooth muscle, basically in your coronary artery. And if you think about another target drug, that means in your PPI, that means omeprazole, rabeprazole, esomeprazole, that will firstly absorb in your systemic circulation, then it will go back to the palatal cell lumen area, that is canaliculi, and there in your acidic condition, it will become active. Okay, and then it will block the proton pump, that is hydrogen potassium ATPase. So these are also prodrug, and that is the site-specific activation drug. Levodopa to dopamine, nitroglycerin to nitric oxide. Okay, other drugs, PPIs, there is omeprazole. So omeprazole sulfenamide, that will convert it into your stomach parietal cell. So that is the target site. So, okay, so these are the site where drug become active. And now we will discuss about the benefits. So benefits, already I said now, like suppose if you think when the conversion happening within your gut or liver, that can easily turn into active and release to the blood. Okay, so now it will minimize the chance to destroy within your gut or within your stomach. So that will increase your bioavailability. That means Prodrug can increase your drug absorption. So when drug absorption will increase in the course of time, then it will increase the bioavailability. Okay, and if you think the drug will just create some irritation in your stomach or your GI tract, then if you think about the aspirin, that will cause some irritation. So if you just take Prodrug form, then you will avoid the local toxicity. If you think about your target target tissue activity, so this is the distributed to the target site and then it will become active. So in other areas, the drug toxicity or side effect will be less. So that is the beauty of Prodrug concept. Another thing, if you think about some drugs are taken in inactive form like codeine, and that will turn into morphine in your liver, and that it will then introduce to the systemic circulation. So that will minimize some addiction side effect. Okay, so in that way you can think that it will increase your bioavailability, increase your distribution, even increase your control your metabolism, and increase the prolonged activity of drug. So in that way you can think, go back to the ADME, then you will get the beneficiary activity of the Prodrug concept. Okay, so Prodrug has multiple positive sides, and because of that, actually, purposely it is done to make Prodrug. Actually, the definition would be when drug will be taken in inactive form and it will turn into active within your body. Sometimes it is said after entering into the systemic circulation, drug will be active, then it is called Prodrug. Actually, this is not the precise answer. The precise answer is after entering in your body, drug will become active. This is all about Prodrug. Thank you very much.